OCD or obsessive-compulsive disorder is the fourth commonest illness in psychiatry. It's seen in almost about 3 to 4% of people worldwide, and it has symptoms of obsessions and compulsions. It's an illness which has a very strong biological substrate to it. Serotonin imbalance is a known fact that causes this illness, and it's a serotonin imbalance that needs to be corrected while treatment also happens.
An obsession is a repetitive thought, idea or image which is very intrusive for the individual who's having this particular problem, and they realize that it is something which is coming from their own mind. It's not something which is just coming from the outside external world for them. And this particular obsession or thought which keeps on coming to them again and again induces a lot of anxiety for the individual, which causes them to engage in certain repetitive acts or behaviors which they feel tend to neutralize that particular thought process for them. So for instance, the person may feel that my hands are extremely dirty, and so they may feel that they need to keep on repeatedly washing those hands. So the thought would be that my hands are dirty, and the compulsion would be that I am going to wash them again and again.
So obsessive-compulsive disorder, because serotonin plays a significant part, one of the core parts of treatment is correcting this imbalance. So your doctor will prescribe you medications which are going to gradually take care of this imbalance, and it has a significant impact. I mean, almost 50 to 70% of people show significant improvement based on the medical treatment given to them. But alongside this, cognitive behavioral therapy also needs to be initiated. A lot of people feel that only medication will do the job. Well, it won't. Once you add both the medications and the therapy, that's when the treatment is complete.
Some of the basic things which therapists would tell you is that learn to ignore the thoughts, tend to delay the response to a particular thought process, make sure that you don't immediately respond to the thought that is coming to your mind. So for instance, if a thought is coming that I need to go and clean my hands, delay it as much as you can. But these would be some of the basic things that you do. But the primary core treatment which is subscribed to for this particular disorder is exposure and response prevention, in which essentially we tend to create a graded hierarchy in which we tend to decide that these are the particular problems which are causing a significant interference with the individual's daily living functioning, and then we tend to work on each of those problems, exposing them to those particular situations, ensuring that the response or the compulsive behavior does not happen in response to that particular situation, and in a slow and steady manner one is able to remove those compulsions from the individual's repertoire or behaviors that they're engaging in.